Well, folks, welcome to Beat Diabetes, and so glad you could join us. And we have a special guest today. His name is Paul Abrinko. Actually, he is Dr. Paul Abrinko. Paul, welcome to Beat Diabetes.
Thank you. Happy to be here.
Well, I'm happy to have you. And, almost everybody I interview, there was something in one of the comments they left under one of my videos that just kind of intrigued me, interested me, or something that caught my
hmm
attention. And we get a lot of comments. And if I remember right, I was trying to find that actual comment, and I couldn't find it today. But it seemed like you were expressing your concern about somebody that you know that had diabetes and really struggled with it. And well, first of all, I thought, well, that's kind of cool that we got a medical doctor that's watching little old Dennis Pollock on Beat Diabetes, and also
You're
that
an
you're
inspiration to me.
well, that's pretty awesome. So tell us how it is that you came to be concerned. I mean, obviously you're a doctor, so every doctor would have a concern because there's so many diabetics in this world. But seemed like you were kind of led along a different path than many doctors. How did you end up watching Dennis Pollock, and what was this individual that you commented on that you saw was really having a real struggle with diabetes? Just
Yeah,
kind of
well,
tell us your story.
yeah, it's a complicated question you're asking, it turns out. I remember the comments I made. You did a podcast on people who might not be too concerned about the diagnosis of diabetes. And you start talking about the eventual complications and what it means to loved ones to have, a family member or a dear friend who has diabetes. And I mentioned in the comments about how when I was a psychiatric resident, so I'm a psychiatrist, I had, she was just a very lovely woman who was in her 60s and had diabetes. And I saw her in weekly psychotherapy. And we were working nicely together and making a lot of progress. And I knew that she would go in and out of the hospital due to complications from her diabetes. And one day we had an appointment scheduled and she didn't show up. And I knew she was in the hospital. And she would come next door to the psychiatric clinic. And so I went looking for her and I found the floor where she had been hospitalized. And the nurses told me she had died the day before from a heart attack. She had a massive heart attack and just died. And it kind of makes me choke up even now, like 20 years later, to talk about it. But that really affected me emotionally to have a patient I cared so much about just, kind of in the prime of her life, just be taken by a complication of diabetes, which I consider a myocardial infarction oftentimes to be. So there was that. Diabetes runs in my family. My brother is a type 2. I was diagnosed as pre-diabetes in the past, and eating low carb has helped me get into a normal hemoglobin A1C range, and I test my blood glucose all the time. I have a cousin who died of complications of diabetes, and then in medical school, a lot of the patients I cared for, like especially at the Veterans Administration Hospital here in San Francisco, it was basically diabetes complication clinic. Amputations, gangrene, peripheral vascular disease, neuropathies, dementia. It was a very, very sad thing to see over and over again. And then the other thing that was kind of frustrating about my medical training is I would ask. I had an uncle with diabetes. He was a type 1, and that was back in the 60s and 70s. And he was, we always talked about Uncle Bill and how he couldn't eat sugar. And during medical school, I was taught, let patients eat whatever diet they please, and we'll just cover it with insulin or other medications. And I asked about that rationale, and they said, well, A, when we tell people to eat low carb, they usually don't adhere to that diet. And B, if they actually do start eating low carb and they get hypo, they could die. So doctors didn't want to have to mess with, potential patient emergencies and hypoglycemic episodes. So it seemed to me, at least that was in the 90s, the standard of care became don't give any dietary advice, just medicate.
Yeah, and
And
sadly, that is exactly what is still going on in many cases with medical professionals, doctors, nurses, nutritionists. Somehow you questioned it even at the beginning, and apparently, the older you became, the more convinced you decided there was more to it than just, well, we'll just give you the meds, we'll give you the insulin.
yeah, right, right. That, and then, when I was in med school, I developed a weight problem. So obesity also runs in my family. I was always extremely thin. But in med school, they told us eat when you can and sleep when you can. And I took that literally and I gained, I don't know, maybe 20, 30 pounds in med school. And I went on a diet. And back then, the focus was on eating low fat and low calories. So I kind of like starved myself for several months. And I did lose all the weight, but it was miserable. And then in the early 2000s, I ran across Gary Taub's book. And I know Gary, he lives here in the Bay Area. I'm in Walnut Creek, and I've had lunch with him, and he's a wonderful guy. And that just really, changed the way I thought about diet and dietary fat and carbohydrates. And on my low fat diet, my triglycerides were high. And when I went on a low carb diet, they normalized. So, that told me right away I was on the right track.
Yeah, well, we sure hear that all the time. I mean, it would be a shocker for someone to go from standard diet to low carb and not have their triglycerides go down as well as their glucose levels. You
Right?
mentioned earlier about this woman patient of yours that died of a heart attack, and you referred to it as a diabetes complication. And the more I study and get involved in just the knowledge of what's going on with diabetes, the more I see that diabetes is kind of like the source, or maybe we could even call it metabolic syndrome, is the source of all kinds of miseries. And a lot of times when people die, they don't put diabetes down as a cause of
Mm-mm.
death. They say heart attack, they say stroke, they might even say dementia, whatever it is. And yet it can cause so many problems. What is it in your professional estimation that makes diabetes so deadly and have so many evil manifestations? Is it just the high glucose? Is it high insulin? And
That's
how does
I
that
think
work?
yeah, yeah, I think both are, culprits. Um it's in to my understanding, the high insulin, insulin is a growth factor and it can encourage cancer cells to grow. Um, it can, encourage like excess repair of arterial lesions, so lesions in your heart. If let's say you incur some damage in a coronary blood vessel because of high glucose, and your body goes to repair it, it kind of goes into overdrive and may cause more scar tissue to form than otherwise might. I'm not sure if the pathophysiology has been exactly worked out, but that's my understanding. And then, high blood glucose is just damaging to virtually every tissue in the body. And it damages blood vessels. We know that for sure. It damages nerves. Your brain is made up of neurons, so I'm sure it gets damaged too, just like, your peripheral nerves do. And in psychiatry, what I see, I see a lot of patients. Some of them are pre-diabetic or diabetic, or they're obese, and I see a lot of carbohydrate addiction and like an extreme reluctance to give up carbohydrates. And to complicate matters, a lot of the medications that I prescribe actually do cause insulin resistance. Some people argue that's not a thing, but they cause the tissues not to respond, at least the muscle tissues, appropriately to insulin, and the fat cells to hyper respond. And many of these medications drive appetite and cause people to become very overweight. And I always tell them, I'm starting you on a medication that I think you need, but may cause a lot of weight gain and may cause hyperglycemia. And I urge you to, follow a low carb diet so that none of these things happen to you. And I find that there's the occasional patient who can comply with a low carb diet, but most of them cannot. So I just, back to your original question, insulinemia, high blood glucose, and then I think just, obesity coming from this very strong hunger drive, and drive to eat starchy and sweet foods combined with fat is just kind of wreaking havoc on many people's health.
Yeah, well, you mentioned earlier that a lot of the doctors that you were learning from in med school were using as an excuse the fact that, well, nobody's gonna follow a low carb diet anyway, so why should we push it?
Hmm.
And yet, strangely, we're seeing a lot of that. I mean, the word is getting out with Dr. Jason Fung and
Oh,
Dr. Eric
he's my
Westman.
hero. And
Okay.
I love Eric Westman, Dr. Bernstein. I think he wrote the Bible on how to, control your diabetes. They're all great, great doctors, in my opinion.
Yeah, and the word is getting out to the degree that people are doing it. I mean, they're following it and actually getting excited about it. So it
Hmm.
seems like in the absence of others that are sharing their good news, in the absence of kind of a team around you or a YouTube channel or a couple of YouTube channels or five or whatever, and some good books to read, in the absence of all that, if your doctor just says, well, you got to go low carb, very difficult, if not impossible, for people to change. But when they get in a community where people are talking about it and saying, you ought to see what my results were and so forth, it seemed like the motivation suddenly appears.
I completely agree. I heard a discouraging statistic that only about, I think, 2% of people follow a low carb diet. And obviously, we've got a huge number of people in the US and around the world who suffer from metabolic syndrome. So the percentage should be more like 70%, right? But I think the problem is that if you just rely on the medical system for your health care, you're not going to get very much encouragement because it means more work for your doctor if you follow this kind of diet, and maybe less money for them and less money for the pharmaceutical industry. And medications like Ozempic are big money makers. And I have a few patients who would rather do Ozempic than, follow a low carb diet. One patient in particular, I'll disguise this patient. He was telling me, and his mom died of complications of diabetes. He was telling me, I followed a low carb diet and I wore a continuous blood glucose monitor, and it really did work. But whenever I fell off the wagon, my blood glucose would shoot through the roof. Like if I had a bowl of oatmeal, or he said even like a little bit of rice with my sushi. On Ozempic, that doesn't happen because I just don't ever eat very much. And and so the Ozempic seems like the answer for him.
Yeah. Well,
But you can't be on Ozempic forever,
no,
I
no,
don't
you really
think.
can't. And the natural way is the best. My personal conviction is that it's just unnatural. The sheer amount of carbohydrate that we take in these days, we Americans and many people throughout the world, is just it's unnatural. It's not
Yes.
that you could never eat a carb food, or that if you eat one sweet potato you're going to drop down dead. We understand that, but we just take them in such huge amounts that it's just not good for us. What
No,
say
it's
you?
not. I completely agree. I kind of think that some of the metabolic problems I've run into had to do with all the sugar I ate when I was a kid. Like, I have such a sweet tooth and I ate lots of it and got lots of cavities. And so I think your exposure to carbohydrates over your lifetime probably influences how much of a risk you have of developing diabetes later on. But yeah, compared to an ancestral diet, we get far, far more carbohydrates than I think is humanly possible to handle.
Yeah, and it's a worldwide phenomenon. I had one man that left a comment. If I remember right, he was from Pakistan, and even over there, they're eating a lot of sugar, a lot of carbs. He said, "I went back to a village diet." He called it a village diet, where they ate more natural foods and no sugar, no white flour, and his problems just went away. So I've never heard anybody term it that way, but maybe that's what we all need is a village diet.
Yeah, a village diet. I love that. I'm not surprised that he's doing better. Are you?
No, no, I really am not.
Yeah,
So you are a psychiatrist, right?
right.
Yeah. So your main thing is not diabetes, but you find quite a number of people coming in to see you that have diabetes. It's
Ex-
it's omnipresent almost, isn't it?
Yeah, yeah. I would say that's absolutely true. That they either have it or they're pre-diabetic or they're overweight. I'm a child and adolescent psychiatrist, so I also see young kids. And, they've got a lot of metabolic resilience, so I don't often see it in them. But occasionally I'll prescribe one of these medications that puts you at higher risk, and the kids will get pre-diabetic pretty quickly. I had that happen to a patient of mine. Now, she was a sugarholic to begin with, so I wasn't surprised when it happened with the addition of the medication, but I do see a lot of it in my practice. And like I said, some of the most useful medications in the psychiatric armamentarium have metabolic side effects. And I always tell my patients to be careful of what
Yeah.
they eat
You
when
know,
they
there
take
is a
them.
term that used to be used a lot, but is not used so much anymore. That was to refer to type 2 diabetes as adult onset
Hmm.
diabetes. But it's not so much adult onset anymore in many cases.
No, no, no. Absolutely not. I haven't seen it myself, but I read that, kids in their teens, even, kids around 8, 9, 10 are starting to get it.
Yeah.
So
That
it's
is sad.
that's a terrible, I mean, think of how many years they're going to have to struggle with diabetes under the current, dietary guidelines.
Yeah,
And if
yeah,
they've got, if they, so a lot of the kids, especially because I deal with children, they come to me for ADHD, and I think kids with ADHD have, well, we know this, they have a special predilection for getting addicted to things. And as we know, sugar is extremely addictive. And the banes of my existence are sugar and video games in child psychiatry.
okay.
Someone's always trying to make money off the kids
Yeah, yeah,
with
and
the
that'll
Fruit
that'll
Loops
sure do it.
and snack foods and video games. And so we laugh. I'm kind of joking about it, but it's very sad how companies go after our children to make their money.
Yeah.
And sugar is one way to do it.
So if you have a patient come in and you determine they do have a severe case of diabetes or even a mild case, what kind of suggestions would you make to them?
I would ask, so, it's a little tricky because if you sense resistance in a patient, like they don't want to cut the carbs, if you start presenting them with information about why it would be good for them, you're often met with resistance. Sometimes people aren't interested in talking about changing their diet, and then I'll say, okay, I just want to tell you that as your doctor, I'm making the recommendation that you do that. It may not be therapeutic for me to tell you how you should eat, but I want to give you the information about a better diet that will help you, live longer and healthier. And I want you to have this information. And it is a little bit of an uphill battle because now with the Ozempic and Wegovy, patients with all the pharmaceutical advertising, they're feeling like that's the way to go, and sometimes they'll think, okay, well, I'll just get on a statin and that's the way to go, or blood pressure medication. So there's a medical model that a lot of patients come to me with in their heads, and so when you present a different way, not everyone is receptive. But I do like to educate my patients and let them know that diet is the best way to take care of their health.
No, that is great. Well, as we bring this to a close, let me ask one final question. You're a medical doctor. You've had all kinds of training and all the anatomy courses and everything else, and yet you found yourself watching at least a few of my videos. Did you not say to yourself, what does this guy know? He's not even close to a doctor. He's a preacher. What in
I
the
never
world?
said no, no, no. So I came across your videos because I watch like Jason Fung and Eric Westman, and Dennis, everything you say is spot on. You are an expert because you've got diabetes and you reversed it, and you talk about what you eat and you present the evidence in your blood sugars, and you're obviously in vibrant health, and you're trying to spread, the good news. And so I think you're rock solid.
Well, I'll thank you for that. It's great to have
Yes.
that kind of a commendation from an actual medical doctor. If you've recently been diagnosed with diabetes and you've just discovered this channel, let me recommend that you go to our uploads page, which will give you access to every diabetic video we've posted since we began. As you work your way through all our videos, I believe you'll find the help you need. A link to our uploads page is in the description.